Hi, my name is Jordan Kressin, and I will be reviewing the journal article and experimentation titled, My Wife is Married and So Is My Girlfriend by Scott Decker and Richard Rosenfield. First of all, we'll be going with a literary review of the article itself, beginning with the study gives a strength behind behavioral adaptations by sampling the risk of HIV among people who do not practice safe sex. The public health campaign based on the spread of HIV is based on the topic of HIV itself and intravenous drug use. HIV is transmissible through sexual contact, but also causes a larger risk to the populations that inject drugs and practice unsafe sex itself. Also to people who have many sexual partners. The study focused on the adaptations of safe sex campaign using gathered data between multiple individuals. High-level criminal justice populations are the highest at risk for the transmission of HIV. They use unconventional behaviors that greaten their risk. The National Institute of Justice says 3/4 of arrestees tested positive for one or more substances and reported using needles, even though they realized that they had possibly been in contact with HIV or were not clean themselves. Also, the large amount of arrestees living very less structured lives between their work, family, which leads to the challenge of initially preventing HIV because these individuals don't have any outside influences that bring back their rejection of practicing unsafe behavior itself. Some of these individuals may lack education also, which doesn't allow them to understand basic health education, or they choose not to follow it overall themselves and follow beliefs that they've been passed down from other people. Not taking safe sex behavior shows little trust or knowledge on the concept. For example, a condom may affect their primary sexual contact or not knowing how the other partner feels about that, so they reject it overall, or takes away the connection between the partners they find, which overall is not true, but it's a belief that they've been passed down over time. This overall ties into the bigger picture that HIV puts so many people at risk, but due to the large population of these individuals that practice the unsafe behavior, it puts the rest of us at so much of a larger risk. Second topic is the method. The study was done through interviews of adult males and females 4 times a year in police facilities regarding their drug use, sexual partners, and needle use. A urine test is administered to screen for a wide range of substances. Adding to the interview was knowledge of the sex practices and self-exposure these individuals put on themselves. Respondents were asked to respond on their safe sex practice, and the responses were broken into 9 separate categories. They were told to explain what they did to protect themselves, which was also only recorded in writing and not with a tape recorder. During the 3 quarters, 959 interviews were completed. In one sample, 8 out of 10 arrestees who were male, fewer than 1/3 of them finished high school itself, which ties into the larger example that I stated before of possibly their lack of education or what they've even been taught with sexual contact. While other parts showed racial composition of the blacks, whites, and 1% of Asian or Hispanic males. Only males and females with felonies were included in the sample. Another study showing levels of illicit drug use separate from the one I'm stating used the Duff survey itself. This overall showed that more cautions need to be taken between these individuals, but also this is the beginning into going over the experiment and how they had set it up. The results, which will be our third topic. First, asking about the exposure these individuals had to AIDS, showed over 1/5 of the sample thought they had been exposed to or had sex with someone that had been exposed to prior. The model on precautions was overall none, because none of these individuals used proper precautions to prevent themselves from being in contact with the illness. 3 separate categories included using condoms, having one partner, being celibate, other categories such as that orange juice method, earwax method. There was multiple categories which we could view each individual themselves on and then put them into that category to get a proper percentage. Males were more than twice as likely to ask their partner if they were clean compared to females, who indicated a lot more higher than males that them and their partners would be tested on a regular basis. Another sample indicated they would, before sex, use, like I said, the earwax method to detect the disease, but also the orange juice method, which is very, in words, binary compared to what you would compare to a regular method, which is involving pushing the individual to drink orange juice and then go use the restroom and seeing if it burned when they urinated to decide if that was a sufficient example or a sufficient reason that they did not have that disease itself. The researchers then broke it into a chart with, like I stated, with percentages per each, which allowed them to view the reasons themselves, but also find further insight into why these reasons were used or methods were used in prevention. Conclusion: the high volume of arrests in St. Louis and those from other populations exhibited the high contact between the drug users, showing that 1 in 5 members believe that they had been exposed themselves to it overall to HIV, and contracted and possibly have contracted in the past or been around someone that had contracted. Overall, the main point explains the large collection of people moving through jails using zero precaution or care. The gay community spreads methods for safe sex through their communities, but the usual arrestees lack the few assets, I find, to use these types of benefits, whereas the gay community itself has spread the word through their community, giving the emphasis to how HIV is very deadly, how it can be spread very easily, and the precautions you need to take. Whereas these arrestees are usually already going through risky behaviors themselves and probably decide not to follow these examples themselves. Overall, proper guidance to arrestees, such as condoms and good understandings, is the biggest thing that they found out. Strict standards have to be applied with all the info that they've gathered, going through the jails, giving emphasis to people, and showing them why the transmission is so easy and how severe the situation overall is. Second part of this, we'll be going over the discussion questions themselves. Question 1. The study viewed the topic by using samples of arrestees under the Safe Sex campaign and the high risk of HIV. The data collected was on individuals' preferred methods of safe sex by using the model for both females and males. The study viewed the individuals over the course of 4 years in the jail. So the study, in essence, is beginning with a pre-test of their initial data and then following up with over a course of time with a during test, if you will, even though I know that's not a sufficient point itself, but then following with a post-test to get the final information. The study uses the idea of selecting subjects, I find, because the individuals are from a certain population with a high risk of HIV itself. Because these individuals are from this population and practice this risky behavior, they're the best people to evaluate in this situation because they are not following conventional methods. This allows, over the course of experiment, to see how the subjects change over time through the idea of maturation, being able to view what they did to protect themselves from HIV. This is an example of a classical experiment which views a group of people over time and observes what they did to change their behaviors over time. The independent variable in this case would be the group itself on the topic of HIV contraction and the spreading of it throughout the population, while the dependent variable is the change they displayed over time with the precautions they took or what they have changed in their life to do with it. Also, it uses a chart with percentages to view what methods each person used themselves. Question 2. A major limitation is stated with possibly only viewing one large population of people, which is the individuals with criminal backgrounds or in the jails themselves. These individuals lack maybe the proper knowledge or health or do not have access to things to protect themselves, which is explained in the article and which I explained prior. The first limitation has to do with only viewing that one population pushes the limitation on these individuals with, of course, are being more prone and being exposed to HIV to do with their lifestyles. But I find it would have added greatly to the experiment if they used data from not only the jails and that population themselves, but going out and viewing possibly inmates that had gotten this information and changed their lives, or even just going and viewing the general public to see the type of methods they used. Because on this topic, we're viewing only jail inmates which practice risky behaviors, when it would be even greater to the information itself if you can go ask just regular people in the general population. If the study viewed people who had reconvened even to the regular world, and just checked up on them to see after they had gone through proper health education and had the proper kits and methods, how they could have changed. They could have used the experimental group as the jail using as the applied stimulus of the precautions they should be taking compared to the control group, which could be individuals who are not getting education of the situation and what precautions they took themselves. Question 3. The major findings showed that safe sex practices among the arrestees were not conventional. 1/3 of them reported to have taken no precautions at all, while others displaying a high level of misinformation and myths that they had believed were actual prevention methods. A big problem was how people attributed this disease to certain kinds of people, putting personal judgment on if someone was clean or not. Having certain social status or looking at someone a certain way does not decide whether someone has been in contact with HIV itself. The area of folk beliefs is striking as well, for example, like the orange juice or earwax method, because like all other methods displayed in this experiment, these methods don't allow any safety for the person, and with the issue of these beliefs, they're passed down through people, and these people that are passing the information don't know themselves if it's a proper precaution. The data collection method itself allowed the researchers to compare which methods were used more and possibly why they had been passed down overall. The most concerning aspect is how misinformed these people really were and how their risk behaviors put them at such a high risk for the disease. Question number 4. The volume of these findings balances the large amount of arrestees in St. Louis compared to those cities with large amounts of African American populations. The frequent movement of these arrestees back and forth, and also the sexual contact between independent variable drug users and non-users showed in previous research. The point that 1 in 5 people believe that they have been exposed to HIV shows the level of severeness of the disease and how no precautions were really taken in the prevention of transmission of it. They also believe that the precautions they are taking are being effective in the prevention of the transmission. In this article, it uses the example of the gay community and how they spread messages in their communities on safe sex. The larger issue is that these individuals, like stated before, possibly lack the knowledge. And overall, a good move forward would be to go throughout the jails, giving safety lessons and giving some sort of kits in a way, like pamphlets on information or clean needles for the intravenous drug users that are sharing dirty needles in the first place. The only way to stop the transmission is when these individuals use proper protection, do not reuse needles if they are intravenous drug users themselves, and when they know very well that they could be contaminated. Thank you very much.